It's Dr. Lindsay with Crystal Lotus Veterinary Care. I was just popping on for a quick public service announcement, if you will, for anyone living in the Los Angeles area or who has friends or family residing here that have pets. Over the last few weeks, there's been a large increase in reported, confirmed, and suspected cases of a disease called leptospirosis here in Los Angeles. Most of the affected dogs either live in or had exposure in locations on the west side of LA County or the San Fernando Valley. There were several dogs exposed at a boarding facility in Santa Monica. Some dogs may have even been exposed at dog parks or dog beaches, and several of these cases have required hospitalization and intensive care. Leptospirosis is a disease that's caused by a bacteria that's shed in the urine of infected wildlife, dogs, and cats. Wildlife that can carry the infection includes skunks, opossums, raccoons, squirrels, mice, and rats, so obviously it's still an issue here, even in suburban areas. Exposure occurs from direct contact, ingestion, or inhalation of contaminated materials. So common sources of exposure include contaminated water sources like a pond or a stream, but unfortunately, exposure can even occur from wild animals passing through your backyard that eliminate. There's increased exposure and concern for animals that are exposed to higher density areas of other animals, and obviously there are limitations like boarding, daycare, training, dog beaches, grooming, and so animals especially that have outdoor active lifestyles, like if they go hiking or camping, are also at a high risk. The bacteria is able to penetrate through mucous membranes, so we worry about infection occurring, or exposure, I should say, occurring through contact with the eyes or within the mouth or even the nasal cavity. So the other issue that we can have is that any sort of cut or scratch can allow the bacteria to directly infect, even with topical exposure. Multiple different strains or serovars exist, and it does live in the kidney of the infected mammals, and so there can also be issues with intermittent shedding over months. All ages and breeds are susceptible, and the clinical signs of the disease can vary dramatically, which can make diagnosis very difficult. Mild cases can have nonspecific signs like lethargy, vomiting, anorexia. For animals that become severely ill, we often see it leading to kidney failure, which can occur suddenly or be a more progressive disease that occurs over weeks to months. Jaundice, which is a yellow coloring of the skin, can occur due to liver inflammation and damage, and some animals will even just have weakness and stiffness and severe muscle pain. The other big concern with leptospirosis is it is zoonotic, meaning that it can be spread from animals to people, with a heightened concern for people who are pregnant or immunocompromised, like the elderly or children. Treatment of this disease is possible, but often requires intense hospitalization, and unfortunately it can be fatal. Luckily, there is a preventative measure that you can take if you feel like your animal may be at high exposure. There is a vaccination available, and so I would highly recommend that you discuss whether or not your animal's risk is worth pursuing this with your family veterinarian, and just be very cautious out there with taking them to any public places right now. I am going to put some links in the caption of this post so that you can get more information about the disease and just review some facts, and feel free to share this with anyone that you feel might benefit from it. Everyone stay safe.